Hi, welcome to the Herbal Hour. Our topic today is a natural approach to fibromyalgia, although we're actually going to cover nature's answers not only to fibromyalgia, but to a lot of related modern maladies that cluster around this problem that we call fibromyalgia. Now, fibromyalgia is actually quite widespread. The definition of fibromyalgia, which has been studied since the 1800s, given different names than the current one, it comes from the Latin word fibra, meaning fiber, the Greek word myo, meaning muscle, and the Greek word algos, meaning pain. So fiber muscle pain is what the word basically means. The medical definition of fibromyalgia is a constellation of chronic symptoms that tend to occur in clusters that include deep muscle aching, burning, stabbing, throbbing pains, and profound fatigue and muscle weakness. This disorder, known as fibromyalgia, affects officially about 2% of the adult population, although some experts estimate that as much as 5% could actually be suffering from it and it's just not being diagnosed correctly. It's 7 to 9 times more common in women than it is in men, and it occurs mostly in women of childbearing age. There are approximately 4 to 6 million people in this country being treated for fibromyalgia. Here's a few more facts about fibromyalgia. Patients are usually in the middle to upper earning brackets. That's kind of interesting. They're typically ambitious, hardworking perfectionists, and this disorder is practically unheard of in third world and developing countries, which suggests that it's origin-based, it's a disease that has its origins in modern lifestyles that are adopted by civilized countries. Now, I have some quotes from some natural healers, herbalists and acupuncturists and so forth, that give us a little more insight about this disorder from a natural point of view. We'll start with Catherine Brown, who says, typically FMS patients, as fibromyalgia syndrome patients, look healthy. Hence, no one can imagine that they are quite ill and in a great deal of pain. As a result, FMS sufferers receive little empathy from family, friends, and even from healthcare practitioners. Chantal Cabrera, who's a professional member of the American Herbalist Guild, says it's one of the most controversial conditions, with some doctors still denying its existence and others using it as an excuse for their inability to determine the actual cause of ill health. Catherine Brown, coming back to her, says Western medical practitioners often avoid billing using a fibromyalgia code, fearing reprisals from the insurance companies because, again, it's a very vague disorder and so forth. Chantal says some argue that it is vastly overdiagnosed and others that it is vastly underdiagnosed, or it's just plain misdiagnosed, and confusion with other pathologies are common. And finally, some health practitioners treat fibromyalgia patients as drug seekers because FMS does not respond well to pain medications, especially those with severe pain. Many are looking for solutions where they might not exist. And of course, that's the topic of this video, is to look for solutions outside of the orthodox medical answers. Let's look a little bit at the specific symptoms that are associated with fibromyalgia. These include recurrent and chronic muscle stiffness and pain, tender points, debilitating fatigue, brain fog, that's cloudy, fuzzy thinking, chronic headaches, poor sleep, and gastric upset. Now, there's a researcher in my study of this topic that has actually considers fibromyalgia part of a cluster of syndromes that he calls Dysregulation Spectrum Syndrome. Mohammed Yunus, a medical doctor at the University of Illinois College of Medicine, views FMS and CFS, that's chronic fatigue syndrome, as being part of a larger spectrum of conditions, which he calls Dysregulation Spectrum Syndrome. And here are some of the disorders that are associated with this DSS, Dysregulation Spectrum Syndrome. Fibromyalgia, chronic fatigue syndrome, irritable bowel, irritable bladder, multiple chemical sensitivities, primary dysmenorrhea, that's menstrual pain, migraines and other headaches, restless leg syndrome, TMJ, and myofascial pain syndrome. Now, what he says is that these conditions all tend to overlap, meaning that people who have one tend to have several of them, and that suggests that they're all part of a deeper underlying problem. In fact, this whole thing is pretty much a medical mystery. In fibromyalgia, numerous tests show nothing abnormal. Symptoms are often transient with periods of exacerbation and periods of remission, and drugs don't seem to help much. In fact, according to the Tufts University School of Medicine, in a follow-up study of 530 people with FMS over 7 years, there was no significant improvement in pain, functional ability, or fatigue. The traditional way that fibromyalgia is diagnosed is that there are certain trigger points, and if you press on those trigger points and a certain number of them are tender, then you can use the diagnosis of fibromyalgia. My good friend K.P. Kaltza, another professional member of the American Herbalist Guild who's done a lot of work with fibromyalgia, has this to say about that. The notion of tender points can identify greater pain at certain locations. These locations are an enigma since their positions don't correspond to particular nerve junctions or other obvious physical landmarks. And Chantal Cabrera agrees that this is really not a good way to look at this illness. It's ridiculous to base diagnosis on 18 specific points. It's not a fair way to diagnose. It's just a clue. A person might have 50 or 100 points and they move around. So what I really want to emphasize in going into this is this program isn't just about fibromyalgia. It's really about this whole cluster of disorders around this DSS that are basically interrelated and are obviously due to things that are happening in modern lifestyles. And I want to refer to an 18th century herbalist, Samuel Thompson, where he says, the knowledge of a name, that's the name of a disease, is cumin and anise, meaning it's insignificant. In the knowledge of the origin, or the cause of a malady, and its antidote lie the weightier matters of this science. All without it is real quackery. And this is, you know, I think that the whole notion of a diagnosis, if we're going to really talk about a diagnosis as a practical tool, I prefer to use the word health assessment since diagnosis is basically copyrighted by the medical profession, and it's illegal for those of us who are not licensed to diagnose. But the idea of identifying a disease, giving a name to a disease, and then saying, oh, I have this disease, okay, is pretty meaningless when it's just identifying a cluster of symptoms without being able to identify a real cause of what's going on and identify what to do about that cause. So really, in this particular case, I think it's much more useful to look at the things that a person may be doing that are causing all of these ill health problems and how they can correct them, and forget about the names, forget about whether we call it fibromyalgia or chronic fatigue syndrome, and trying to differentiate different patterns of symptoms, because they do overlap a lot, and I think it's a mistake. So there are two ineffective approaches to this kind of thing, and the first one is symptomatic relief with either drugs or supplements. That is, just applying remedies based on trying to relieve symptoms. But the second ineffective method is what I call supplement recipes, which are based on a medical diagnosis. So someone goes to a doctor and they get diagnosed with fibromyalgia, and then they look up in some herb book, including the one I've written, and they read a recipe list of supplements that have been used for that illness, or somebody writes a little recipe of some supplements they've had some experience that have helped some people with fibromyalgia or whatever, and they take those little supplements. This is a very ineffective way to go about this. What's more important and what's better is to really take a look at the person, not the name of the disease that's been given by the doctor. In other words, the diagnosis is pretty irrelevant. You know, the medical diagnosis is pretty irrelevant to natural therapy. What's more important is taking a deeper look at what some of the underlying problems and imbalances might be, so we can strive to correct them. The model I've used for years to teach people how to do this is called the disease tree. And basically what it shows is that the illness arises from unresolved mental and emotional stress, nutritional deficiencies, physical injuries, and toxicity of the system, all of which upset the biological terrain, disrupt the body systems, and give rise to the various kinds of disease. So what we're going to look in this program is we're going to look at 4 probable causes of fibromyalgia and all of these other symptoms that are associated, or these illnesses that are associated with DSS. first one is nutritional deficiencies from refined and processed foods. The second one is digestive weakness with intestinal inflammation, yeast infections, or parasites. The third one is environmental toxicity and with impaired liver detoxification and elimination functions. And the fourth one is adrenal exhaustion due to chronic stress. When I see people who are suffering from these kinds of chronic illnesses, whether they've been labeled with fibromyalgia or autoimmune disorders or chronic fatigue syndrome or whatever, the common things that these people all tend to have from the way I look at the body is they tend to have nutritional deficiencies because they haven't been eating right. They usually have digestive weakness. They've been exposed to some kind of environmental toxins, and they're usually what I call burned out. They've got exhausted adrenals due to stress. So what we do is going to take each of these four basic causes, look at it, some of the things that would identify that this is a problem, and how to correct it. So let's go to the probable cause number one, nutritional deficiencies from refined and processed foods. It's really no secret that the reason why we have so much chronic and degenerative disease in Western civilization is because of refined and processed foods. In the 1930s, Dr. Weston Price, very prominent dentist, toured 6 of the 7 continents on the world, studying indigenous peoples living off their traditional diets versus civilized people living on modern diets in the same terrain. And everywhere he went, he found the same pattern. People who lived on traditional diets, which were basically based in natural foods they gathered from the environment, were free of pretty much most disease. They had healthy bones, healthy teeth. They didn't have tooth decay. They didn't have wisdom teeth extractions. They had great mental health. Everywhere, when he compared that with populations eating refined and processed foods, he saw, mental health problems coming up, deterioration of bones and teeth, and a whole bunch of chronic illness to go with that. So this is really one of the major reasons why so many of us are so sick. So when you have a very serious chronic disease like this, it's very important to get on a very good natural foods, nutritionally dense diet. So some of the basic nutrition would be 80% alkaline diet. That means predominantly fruits and vegetables, preferably raw, about 80% of the diet. Avoid refined and processed foods, and identify and address basic nutritional deficiencies, and also test for and remove any foods that may be causing allergic reactions. Now, the 80% alkaline diet is basically what's called a mild food diet. A mild food diet is basically getting off of all of the junk food, pretty much off all grain, sometimes even temporarily off any kind of meat or animal products, and just eating lots and lots of fresh fruits and vegetables, maybe with some nuts and seeds and some things like that. You don't have to be on this kind of diet forever, but this basically helps you get away from the cravings for junk food, starts giving your body the kinds of nutrients it needs, and it starts alkalizing your system. Because most people who suffer from these chronic ailments, they're over acid from eating too much meat, grain, dairy products, soda pop, and so forth. A diet that's high in vegetables leads to a substantial reduction in joint stiffness and pain, as well as improved overall health. So the ideal thing to focus on in diet is predominantly vegetables. Now, there are some specific nutritional deficiencies that are associated with fibromyalgia. One of them is magnesium, another one is omega-3 essential fatty acids, iodine, deficiency of antioxidants, enzymes, and an amino acid called L-glutamine. So we're going to look at each one of these again. The first one is magnesium. Magnesium is a very important mineral in the body because it's required for the synthesis of adenosine triphosphate, or ATP, which is used inside the cell to manufacture energy. And when there's a deficiency of magnesium, it can lead to anaerobic glycolysis, which means cells are producing energy without oxygen, which creates lactic acid formation in the muscles, which causes pain. So one of the most basic deficiencies typically present in people who have a lot of muscle pain is magnesium. Magnesium also is essential for muscles to relax. So if you don't have enough magnesium, you're going to have stiffness. Now, the primary way that we get magnesium in our diets is from the magnesium found in the green molecule chlorophyll. So if we have a diet that has a lot of dark greens in it, dark green lettuces, chard, turnip greens, mustard greens, kale, collards, spinach, these kinds of vegetables, you're going to be getting the magnesium you need. Unfortunately, very few Americans eat much of this kind of food at all, which is one of the reasons why I think we have a lot of problems with magnesium deficiency. Now, there's a very good supplement called Fibromyalgia, which consists of malic acid mixed with magnesium. And this combination helps to conserve muscle protein. It helps to increase the ATP production and the aerobic glycolysis, which helps reduce pain and stiff muscles and helps also to reduce fatigue. So this is one basic supplement that anyone who's suffering from fibromyalgia or chronic fatigue or related kinds of conditions might want to consider trying. The next supplement we want to talk about is omega-3 essential fatty acids. Omega-3s are necessary to counteract excess omega-6s in the diet. Omega-6s are predominantly found in most vegetable oils, and without enough omega-3s, omega-6s actually create pro-inflammatory prostaglandins and chemical messengers. So when you add more omega-3 into the diet, it helps to reduce inflammation and pain by promoting the production of more anti-inflammatory prostaglandins and chemical messengers. This helps to balance your immune functions and is also important for feeding your nerves, because your nerves are, once you remove the water from nervous tissue, your brain and your nervous system is about 50% fat. And most of that fat is based on omega-3 essential fatty acids. So because we're not getting enough omega-3 essential fatty acids, it weakens our brain and nerve tissue and makes it more susceptible to irritation and can cause a lot of problems with pain. So omega-3s are a very, very important supplement for anyone who is suffering from any kind of chronic pain, especially if the cause is difficult to identify. Another critical nutrient that's often missing in fibromyalgia and other people is iodine. In fact, there is a definite link between low thyroid and problems like fibromyalgia. Iodine is an antiseptic and a disinfectant and is absolutely essential for the production of thyroxine in the thyroid gland. Iodine helps to remove toxins like bromides, chloride, and fluoride and mercury from the system, and it's essential for the metabolism of fats. In order to be able to burn and combust and utilize fats in the body, you have to have iodine. Dr. David Brownstein, author of the book Iodine, Why You Need It and Why You Can't Live Without It, says in his book he's seen many cases of fibromyalgia clear up using iodine supplements alone. So high doses of iodine can be very beneficial for this. My naturopathic friend, Dr. Kimberly Ballas, actually discovered quite by accident that black walnut was really beneficial for fibromyalgia. Black walnut is one of the natural sources of iodine, and it's both antimicrobial and antiparasitic. It's also mildly detoxifying. It helps to balance immune function, and it has definitely proven beneficial for fibromyalgia. She was asked to participate in a study. It was a double-blind study on fibromyalgia, in which Dr. Barry Sears, author of the Zone Diets books, was also participating, and they were testing a new drug against omega-3 essential fatty acids, and she was supposed to pick an herb to act as the placebo, and she picked black walnut. Well, They didn't publish the study and they threw it out because the omega-3s in the black walnut improved the symptoms of the fibromyalgia much better than the new drug. So you'll never read about that. But Kim started using black walnut with fibromyalgia patients and found that that herb alone helped a lot with their problems. And later I was mentioning this to KP Kaltza, my other professional member of the American Herbal Guild and good friend of mine, and he said that he independently through muscle testing found that black walnut was very beneficial for fibromyalgia. So that's another supplement that I highly recommend. Kim tells me that now she's tending to use the higher potency iodine supplement iodoral in place of the black walnut and getting very good results with that. But I definitely think that the black walnut or liquid dolts or any other source of iodine in fairly large amounts, I would use like the concentrated black walnut and at least 2 or 3 a day, or taking at least a couple of teaspoons of liquid dolts a day if you're having situations like this. The next supplement to really look at is antioxidants. I've never seen anyone who had an autoimmune disorder or fibromyalgia or any of these things who didn't have a lack of antioxidants. Antioxidants help reduce pain and inflammation, and they protect the body against environmental toxins, as well as help to modulate or balance the immune function. Now, how we normally get antioxidants in our diet is by eating lots of fresh, preferably raw, fruits and vegetables. But again, most people in our society don't do that. Their amount of fruits and vegetables in their diet is typically very limited, maybe to a piece of lettuce and a cardboard tomato or something like that. But they aren't getting these fruits and vegetables, so they're not getting the antioxidants. Spices are another source of antioxidants, things like ginger, rosemary, thyme, oregano, etc., as is chocolate and green tea. A great antioxidant supplement to consider with anybody who's suffering from fibromyalgia, chronic fatigue, or any of these other DSS symptoms is Tigo. Tigo contains mangosteen fruit and mangosteen pericarp, which is rich in compounds called xanthones, which have been proven to be highly anti-inflammatory and antioxidant and very beneficial for these types of problems. Tigo has the highest ORAC rating of any supplement in its class. ORAC is oxygen radical absorbing capacity, which means it's the ability of a substance to absorb free radicals. And Tigo is actually certified in its ORAC content, its xanthone content, and so forth. And it's not only one of the most potent of the antioxidant beverages, but it's also really good tasting and very easy to take. So I would definitely recommend Tigo as another important supplement to consider with this. Enzymes are another thing. Anybody I've ever seen who's suffering from fibromyalgia or any other kind of chronic illness typically has very weak digestion. And so enzymes are typically deficient in people with these kinds of conditions. And this is due to a lack of raw and enzyme-rich foods in modern diets, as well as the fact that many modern foods contain enzyme inhibitors. The two major sources of enzyme inhibitors that are causing people to wind up having problems with enzymes are food additives. Preservatives, in many cases, are designed to inhibit enzymes in order to slow the breakdown of food or the decay of food. In addition to this, seeds contain natural enzyme inhibitors to hold the seed in a dormant state until it's ready to sprout. So all grains, nuts, beans, sesame seeds, pumpkin seeds, etc., sunflower seeds, all contain enzyme inhibitors. And the only way to get rid of these is to soak the food before you eat it. And all native people, Dr. Price found, soaked grains, nuts, and beans and seeds before they cooked them and ate them. So I think considering the amount of grain and these other kinds of foods people eat, as well as the preservatives, it's no wonder they wind up enzyme deficient. The last supplement, glutamine, has to do with, leads us into the next probable cause. Glutamine is a major nutrient intestinal cells need for maintenance and repair. It reinforces the first line of immune defense. There's considerable evidence that glutamine can aid the gut in its role in protecting against viral, bacterial, and food allergen antigen invaders. In talking with Kim Ballas, she says that one of the major things she's found with fibromyalgia is that these people tend to have leaky gut syndrome. And that leads us into probable cause number 2, digestive weakness with intestinal inflammation, yeast infections, and parasites. And L-glutamine is one of the supplements that actually helps with repairing the leaky gut. And so what leaky gut is basically when the intestinal tract becomes inflamed, the tissues of the intestinal tract swell. And in the process of swelling, they become more porous, and they don't function very well in filtering toxins or absorbing nutrients the way they should. So you have to reduce the inflammation and tone up the intestinal membranes so they become more resistant to allowing chemicals and other toxins into the body. But before we talk a little more about leaky gut, I want to mention the hiatal hernia. This is almost universal in people with fibromyalgia, autoimmune disorders, or any other kind of chronic illness that we're talking about in this classification. And the hiatal hernia inhibits deep breathing and also inhibits digestion. Jack Richardson many years ago taught me how to mechanically correct this. It does require mechanical correction. There are no supplements that will actually fix this problem directly. But I've never seen, he said that all chronically ill people have this. I have never seen a chronically ill person who does not have this problem. And so I consider it one of the foundational therapies for helping anybody who's suffering from any kind of chronic condition like fibromyalgia. Now, I'm going to demonstrate, there's a bonus segment at the end of this DVD where I'm going to demonstrate how to work on a hiatal hernia for those who are interested in learning how to help someone who's got this problem. But back to the intestinal inflammation and leaky gut, which often goes along with the hiatal hernia. When you have this problem, you need to clean up the diet like we've talked about and use some supplements that are going to help rebuild and restore tone to the intestines. And 2 really good choices are the Uno de Gato or cat's claw combination, and another one is the kudzu St. John's wort combination. Also, the L-glutamine that we mentioned earlier is another useful supplement for helping tone up the leaky gut. You might also want to consider if a person might have a chronic yeast infection, if they've taken lots of antibiotics in the past, or birth control pills, and have a tendency to sinus infections and so forth. They may have a yeast overgrowth problem, and in that case, you might want to consider taking something like yeast fungal detox. If they've traveled abroad or may have been exposed through pets or whatever to parasites, they may also need to do a parasite cleanse in order to fix their digestive problems. Fiber is also important for colon health. Fiber binds toxins in, oh, wait a second, sorry, I'm skipping ahead. I need to talk about probable cause number 3, which is environmental toxicity with impaired liver detoxification and elimination. Obviously, one of the things that's causing problems in modern society is chemical pollutants. And with any kind of autoimmune disorder, fibromyalgia, chronic fatigue syndrome, there are usually toxins present in the system that need to be gotten rid of. The problem is that you can't use harsh cleanses. The kind of detoxification that you need with these kind of conditions is gentle detoxification. That's not going to stir up the toxins too quickly, because when you do that, the person really doesn't feel very good and they don't like you very much, and they're not likely to stick with the program. So a good thing to do is to use very small amounts of detoxifying remedies, such as liver balance, maybe 1 to 2 capsules per day, Enviro Detox 1 per day, or heavy metal detox 1 per day. You don't need to take all 3, but picking any one of those can be useful, taken in the small doses to start a gentle detoxification process. And that leads us into the fiber issue, which is fiber is real important because fiber binds toxins in the intestines for elimination. It's going to help repair the leaky gut, and it's going to gently and passively detoxify by pulling toxins out of the system. Some of the supplements to consider are algin, which should be used with heavy metal detox for pulling out heavy metals, or Everybody's Fiber or psyllium hulls combination, which are good general fiber supplements. Another problem that may happen is with fibromyalgia is a difficulty in cellular energy production, which is making it difficult for cells to kick toxins out of the cell into the fluids for elimination. In addition to the fibralgia, which helps with that, Cellular Energy is another great supplement. It contains B vitamins, minerals, and compounds that are used as part of the Krebs cycle that produces energy, or ATP, and enhances ATP production. So Cellular Energy has the following benefits. It aids in the production of ATP for energy at the cellular level. It helps reduce fatigue and weakness. It helps increase stamina, and it helps cells kick toxins out so that they can detoxify. The next major cause we want to talk about, probable cause number 4, is adrenal exhaustion from chronic stress. And my friend KP Kaltza has said this about people with fibromyalgia. He says they typically have type A personalities. They're often high-achieving women that are burning the candle at both ends and in the middle. And so basically, he considers this a health collapse with immune involvement. I have, again, anybody suffering from any kind of chronic pain, chronic inflammatory disorder typically has very exhausted adrenals. There are a number of things that are going to exhaust the adrenals. One of them is caffeine, another one is sugar, another one is chronic stress. The adrenal glands are responsible for helping us cope with stress. They synthesize cortisol, epinephrine or adrenaline, testosterone, and other hormones which help build muscle and give us energy. They help to balance blood sugar levels, they help to balance fluids and minerals in the body, and they provide our body with energy and stamina. So it's easy to see that when you are suffering from chronic pain and inflammation, when you're lacking energy and you're tired, and you've got vague symptoms, that the adrenal weakness could be a big part of that. Now, adrenal weakness, one of the main things I mentioned is it can be brought on by just chronic long-term stress, or chronic long-term inflammation can cause it too. But chronic stress depletes the adrenal glands, which produce cortisol to control pain and inflammation. So not only adrenal exhaustion is common in these disorders because they're usually involve some kind of inflammatory process. Although in fibromyalgia there is no obvious inflammation, there's some kind of an inflammatory-like problem going on deep in the muscles. Some of the helps for treating this adrenal exhaustion include avoiding refined carbohydrates, alcohol, and caffeinated beverages. Caffeine is murder on the adrenals when they're exhausted. Supplements that you'd want to consider to help rebuild the adrenals include adrenal glandulars like adrenal support, adaptogens like Adaptagens, and anti-inflammatories. Here are some of the, let's look at more closely at some of the options that you have for helping to rebuild these, and start with some adaptogens. A couple of good adaptogens that my friend KP Kaltza has found useful for working with fibromyalgia include ashwagandha, which is in Adaptagens. It nourishes and regulates metabolic processes, increases endurance, helps performance and memory. Eleutherococcus or eleuthero root is helpful for fatigue, stress, anxiety, poor concentration, and diminished endurance. Anti-inflammatories can also be helpful here because they help with the cortisol effect. Licorice has a cortisol sparing effect. It's anti-inflammatory and supports and helps rebuild the adrenals. Yucca is really good for chronic pain. It mimics cortisol, is mildly detoxifying, and a useful pain remedy. And turmeric has antioxidant properties, promotes tissue healing, and suppresses pain. And these are herbs that are recommended by people like KP Kaltza and Chantal Cabrera, who've worked a lot with this problem. I think The adrenal glandular, adrenal support, is a really good supplement to consider with these kinds of problems. I've used it a lot. It's a high-quality bovine adrenal substance with adaptogenic herbs, vitamins, and minerals that helps to normalize adrenal function and supports the body's ability to regulate stress. And it really does help to calm down inflammation and pain when it's involved with the adrenal problems. Another formula to consider, especially if there's problems with sleep, is nervous fatigue formula. This is another adaptogenic formula that helps resolve something called yin deficient heat, which is inflammation and pain associated with fatigue. It also improves sleep and helps with liver detoxification and has a protective effect of the liver against chemicals. I've used this one a lot where people are tired but are having difficulty sleeping. I find it very beneficial for helping people get a better night's sleep and have more energy during the day. It's very important not just to take the supplements, but also to learn how to deal with stress. If you have chronic illness like fibromyalgia, you need to learn to pace yourself. What happens is you tend to, as soon as you start to feel better, you've got that hard driving type A personality, you just run out and start doing something and you throw yourself back. So you've got to learn to pace yourself, set realistic goals, don't overdo it, give your body a chance to rest. Get plenty of sleep, take naps if you have to, get outside and enjoy nature, and practice deep breathing exercises. All of this stuff is going to help you to slow down a little bit, not push yourself so hard, and be able to give your body the chance it needs to do what it needs to rest. Deep breathing is really important for any kind of chronic pain problem. Again, at the end of this DVD, I have a short segment on working with a hiatal hernia. Anytime you can get someone's stomach to come down and get them doing deep abdominal breathing, it is going to reduce the level of pain in their body by helping them oxygenate their tissues. Now, some other useful therapies that are good for reducing stress are to practice yoga or stretching exercises. As you stretch muscles, it helps them relax. Meditation or other forms of relaxation that are not stimulating. I mean, we're talking about you don't want to go see like movies or theater. You want to do something that's quiet so that it helps to get you to relax. Walking in nature, getting a massage, or Epsom salt baths. Epsom salt baths are great because Epsom salts are a magnesium sulfate, and if you put a couple of cups of Epsom salts in a warm bath along with 10 to 15 drops of your favorite essential oil, maybe something like lavender or rose or something that's calming and relaxing, you soak in that bath. The magnesium helps to relax your muscles, helps your body gently detoxify, and can be great for helping to relieve pain. Now, there are some other, okay, that's kind of like the core things that you want to do with something like fibromyalgia, the basic supplements, basic lifestyle changes, and so forth. But of course, when a person's in pain and they're having a lot of discomfort and so forth, there are things you need to do to help a person get immediate relief so that they actually start feeling better, while some of these other things that are working on the deeper issues have a chance to take effect. So some other useful herbs and therapies here include using analgesics, circulatory tonics, muscle relaxants, and exercise in order to be able to help the body heal with this. Analgesics are herbs which help relieve pain, and some good ones to consider here include California poppy, which eases pain, is antispasmodic and sedative; nutmeg, which is found in deep relief oil, it relaxes muscle tension and eases pain; Corydalis is a Chinese analgesic that helps with insomnia, pain, and stiffness; and wild lettuce, which is found in APS2, is antispasmodic and is calming to the nerves. Any one of these could be helpful. You can apply topical analgesics like deep relief oil or even Thai fu oil to massage into muscles to help them to relax. and then again, like try any of these herbs to actually help with pain. These are again recommendations from other professional herbalists who work with this. It also is helpful to stimulate circulation to the periphery of the body. Some great herbs for doing this include capsicum, which has a normalizing effect on circulation throughout the body. And it also has pain-relieving qualities because it depletes substance P, which is a neurotransmitter that transmits pain. Prickly ash is an herb that helps stimulate peripheral circulation and can relieve pain. And ginger also aids circulation and digestion and is anti-inflammatory and helps, again, to put blood flow out to the extremities, which increases oxygenation of tissues and reduces pain. Another thing to consider is muscle relaxants. Muscle relaxants are remedies that will get rid of muscle spasms. One of my favorites is lobelia. It's a very powerful antispasmodic and a very good pain reliever, and works very well with capsicum for helping to relieve this kind of chronic pain. If you're getting cramping pains, cramp relief is a good option to consider. It relaxes muscle cramps. And another one is kava kava, which is a very powerful muscle relaxant. If you have a real tendency to stiff and achy muscles, kava can help. It's also a mood elevator and a mild analgesic. It can help to relieve pain. Some other helpful supplements to consider are algae, which is found in superalgae. Taking this can decrease the intensity of pain. Bacopa, which is an ingredient in ginkgo gotokola with bacopa, helps with the brain fog in fibromyalgia, helps a person think more clearly. And ginkgo biloba aids circulation to the periphery. So another good supplement to consider would be the ginkgo gotokola with bacopa. Finally, the last thing on our thing is some exercise. It really is important for people with fibromyalgia to get some physical activity. Physical activity moves lymph. Lymph movement helps detoxify the cells, helps bring blood and nutrients to the cells, and aids in healing. The thing with any kind of disorder of chronic fatigue, fibromyalgia, and so forth, is that you don't have to be extreme to get the benefits. Just 20 minutes a day or even 30 minutes 3 times a week will have positive effects, and they should be activities that aren't really strenuous, just like taking a walk, going swimming, doing some yoga or tai chi, just doing some stretching exercises, or doing some lymphosizing exercises, which is gently bouncing up and down on a mini trampoline. By increasing lymph flow in this way, it goes a long way towards helping the tissues of the body to heal. I hope that you gather the main point of this DVD is fibromyalgia isn't just like, when you're dealing with this kind of chronic problem, there's no like little magic bullet, little recipe, whatever, because these are syndromes. They're syndromes brought on by our nutritionally deficient, toxic, stress-filled lives. And the solution isn't, some magic bullet, here's the little recipe of how to deal with it. Instead, it's taking a look at some of these issues and starting to make some changes to our lifestyle, doing some gentle detoxifying, learning to deal with stress better, and so forth. I have some suggestions for some selected reading. Chantal Cabrera has an excellent book on fibromyalgia. KP Khalsa has written some really good materials on fibromyalgia. There's this book, Fibromyalgia, My Journey to Wellness, and Iodine for Health by Donald Miller. And there's also, not listed, but David Brownstein's book on iodine, which also helps. So, if you're one of the millions of people who are suffering from fibromyalgia, or you are a natural health practitioner who is trying to help people with fibromyalgia, or you know someone who has fibromyalgia, I hope you'll find this information helpful in bringing them some healing and some relief so that they can improve their health. Thank you. Hi, I'm now going to show you how to identify and correct a problem called a hiatal hernia. And helping me is Helen from Russia. She's visiting America. And first thing I want to say is Helen is the typical kind of person who has a problem with the severe hiatal hernia. When people are tall and slender, they're the ones that have this problem the worst, although it can happen in anybody. And Helen, you've had asthma, and some other health problems, right?
Yes.
And we've been working with this with her a little bit, but I want to demonstrate first of all how you identify this with muscle response testing. So I'm going to push her arm, I'm going to check her polarity. Like this. And now I'm going to go right here to the solar plexus, right here. I'm going to hold, and you see she's weak there. And just to demonstrate, I'm going to check some of the other things: nervous system, pituitary, lymphatics, thyroid, thymus, lungs, blood, heart, and circulation, liver, colon, small intestines, kidney, adrenal. So there's a number of things here that are testing weak. Now what I want to show you is I'm just going to really quickly just flick like that, like I'm pulling her stomach down just a little bit, and I'm going to retest her. Hold. Thyroid, lungs, lymphatics, liver, circulation. That's still a little weak, but it's better. And this is what happens. The stomach comes down through an opening in the diaphragm called the hiatus, with the esophagus, and then kind of curls around like this. And what happens here is the stomach slides up into the opening in the diaphragm and impedes the movement of the diaphragm, and it also interferes with digestion. It puts pressure on the heart, it lessens a person's ability to breathe with their lungs, and interferes with their ability to digest food and absorb nutrients. So Helen, take a deep breath for us. And notice how she breathes up here with her shoulders. Okay? Now if I breathe, see my shoulders hardly move. But the reason that she has this problem is because her stomach is actually in the way and interfering with the movement of her diaphragm. So we need to correct this. And one of the things that causes this is emotional tension. So one of the things you can do to let go of it before you even begin any other kind of mechanical thing is to practice throwing a temper tantrum. So, and this is very hard for people with hiatal hernia to do, by the way. You grit your teeth and you clench your fists and go like this, like you're really mad at somebody, and you go, take in a deep breath and go, okay. One of the things you notice is how that's primarily coming from her throat. In other words, there's this kind of like constriction here. It's really hard for her to do. And people who have this problem usually laugh when they do this because they can't, because it feels uncomfortable, doesn't it? Yeah. Yes. So try it again. Let it come from down here. Okay, now take a deep breath. Okay, and a lot of times that will loosen it up a little bit, but in this case it didn't. That takes some practice to get that to drop down. So what we're going to do is we're going to switch the camera here for a second and come back, and I'm going to show you how to correct this with her lying on the massage table. Okay, so we now have Helen on the massage table, so I can demonstrate how to work on this problem of the hiatal hernia. And while you can do this through clothes, it's actually easier to do it on bare skin. So I'm going to just lift your shirt up like this. And you see her ribs coming right here and right here. And right in between her ribs, there's that little soft spot of the solar plexus. And this is where you're going to be doing your work. Now, normally, I would do this a little harder than I'm going to do it right now, but we just got back from lunch, and so you can't like really pull hard on a stomach where you've just eaten. So, but what you do is you start under this side, and you just kind of gently pull your fingers in here and work your way up to that little spot right there, and you'll feel kind of the stomach moving. And then you have the person take a deep breath and hold it, and you'll feel you kind of get a hold of the stomach, and now exhale hard. And you pull down on that area like this, only you do it a lot harder than I just did. Let's do that again. Take a deep breath and blow it out and pull down. You can even just do gently pulling down like this, just alternating your hands like so. And that will help to open up, get that stomach to drop out of the diaphragm. A technique I learned from Deanna Hansen, a certified athletic therapist in Canada, that really helps is also to just do gentle massage on the abdomen, just rotating your fingers around and just kind of relaxing the whole abdominal area, and just doing this for like 5 minutes a day, and especially paying attention to just kind of massaging right here under the rib cage, like so, because this actually helps to bring the stomach down. Now take a deep breath for me. Okay, and what you're looking for, relax, let it go, is you want to see movement right here with the stomach and the ribs rising down here instead of so much up here. And that tells you that you're getting some progress in opening up breathing. And again, I'm just going to work on it just a little bit. And again, take a deep breath. And you can see the movement taking place there. What often accompanies this is a problem with the ileocecal valve. And the way you locate the ileocecal valve is you find the point of the hip here and the belly button, and draw an imaginary line between those two. And right midway on that line is where you'll find the ileocecal valve. You go just below that with both hands and you push, and it's usually a little tender, right? And you basically lift up like this and hold it until the tenderness stops, okay? Which actually usually takes 2 or 3 minutes, but we're not going to spend the amount of time to do that on this DVD. And again, just even doing this kind of gentle massage will help to get that moving. The ileocecal valve is the valve between the small and the large intestines, and when it gets inflamed, it lets material from the colon come back into the small intestines, which causes gas and bloating that pushes up on the stomach. You also may need to work on the valve of Houston, which is an area of the colon that constricts to let out gas. And basically, if you start at the belly button, go 2 inches down, 1 inch to the other side, and go straight down, and that one is often tender too, and people have a hiatal hernia. Yeah, it doesn't feel very good, does it? And you hold that again until it stops hurting, which usually takes about 2 minutes, okay? And oftentimes after doing that, you'll actually get some additional benefit right here. Take a deep breath again. Yeah, we got a little better movement that time. So Jack Richardson does this really hard. He really gets up there with his fingers and gets under the rib cage and literally jerks the stomach down. I find that doesn't do very much good because usually the tension created by that makes it go right back the way it was. So I find working on it gently every day like this is much more beneficial. So that concludes that demonstration. I'm going to reset the camera and I'm going to show you a couple of self-help techniques that you can do working on this yourself, in addition to having someone work on it like I just showed you. When a person has a really severe hiatal hernia, you actually really need to have somebody else work on it with massage because it's very difficult to get it down yourself. However, I do know people who have been able to get them down using the self-help techniques I'm about to demonstrate. However, even if you are working on it for somebody, they usually need to do these techniques to help learn to get it to stay down, because what happens is you lose muscle tone up in here and it tends to slide back up, and you have to keep it down consistently long enough for the tissue to tone up in here and for it to start to heal, so that basically the stomach doesn't keep sliding back up into the diaphragm. Now I'm going to demonstrate these two self-help techniques. The first one actually works best if you're lean against a wall. And I'm not leaning against a wall, but I'm going to pretend there's a wall behind me. And you bring your hands up under your rib cage till you're right there, almost touching, like so. You take a deep breath so you can get a hold of your stomach like that, leaning backwards just a little bit, and then you exhale and go forward while you push down. Like that. Let's demonstrate that again. You bring your hands up here like this, lean back, take a deep breath, lean forward as you push down. That helps to release that. The other technique is one that's really, really effective. You wake up in the morning, you take a couple of shots of lobelia. Lobelia really relaxes the solar plexus and is very helpful for helping to relax the tension that's in here and bring down the hiatal hernia. After you're taking a shot of lobelia, you need to drink at least a quart of room temperature water. So you're basically filling your stomach with water so it forms kind of a weight in the bottom of your stomach. Then what you do is you stand on your tippy toes and drop suddenly to your heels, or you can even jump down a flight of stairs, so that it's the same effect that you get when you go down an elevator real fast. You get that so that the weight of the water in your stomach helps pull the stomach out of the diaphragm. You can enhance that using the same technique here by going and blowing out and blowing out. In addition, as I mentioned, people who have this problem tend to be holding on to a lot of frustration, anger, and stress here because they don't know how to let it out. And so it also really helps, again, if you practice and letting only, I do it a lot more than that, like, and that really helps to relax the diaphragm and get rid of some of the tension that's there, and helps again to bring the stomach down. As I mentioned on the DVD, Fibromyalgia, this problem is almost universal in people who suffer from chronic fatigue syndrome, fibromyalgia, autoimmune disorders, cancer, or any other chronic and degenerative disease. I would say that learning how to deal with this problem, helping people release the tension from the solar plexus and open up the diaphragm, helping open up the lungs, improve the heart, and improve the digestion, is one of the single most important things I've ever learned to do to help people who are chronically ill get well. I have seen people having problems like heart palpitations, asthma, respiratory problems, digestive problems, immune problems, and so forth, all improve once they got to the point where this was down. I want to also indicate that the way you know it's down is when a person can breathe deeply from their diaphragm like this. In my experience, about 70% of the adults I know cannot breathe deeply from their diaphragm, and learning to be able to practice deep breathing from your diaphragm is one of the best things you'll do to protect your health and also to relieve chronic pain. I hope you find this information useful, and thank you for allowing me to demonstrate this.